The Director General, National Senior Citizen Center, NSCC, Dr. Emem Omokaro says the center will continue to seek ways to accelerate the social inclusion of older persons in Nigeria's development agenda. Omokaro said this at a two-day national stakeholders workshop on integrated care of older persons with the theme Realigning and Strengthening Institutional Capacity for Delivery of Integrated Care for Older Persons. The director therefore highlighted the aims of the workshop and the need for improved primary care for older persons.
As the theme says, realigning and strengthening institutional capacities to deliver integrated care for older persons. What we seek to achieve is to, first of all, identify the baseline. What are already those things that are in existence that we can build on in the primary care? Or what are those initiatives, innovative initiatives that we can bring in? What capacities need to be strengthened in terms of human resource, in terms of infrastructure, in terms of logistics and coordination that would indeed put older persons also central in the provision of primary care, would bring geriatric care promotion, and then would synergize between the primary care and family care because they are in the community. So we expect that the outcome document after 2 days of very technical deliberations with these people that are already in the field and are in charge of primary care and older persons themselves who are self-reporting and telling them what they feel within the communities and care providers, community care providers within the communities. I think the outcome document is really going to give us a plan of action.
In her address, Hajiya Sadiya Umar Farouk, the Minister of Humanitarian Affairs, Disaster Management and Social Development, represented by Alhaji Musa Bungude, Special Advisor to the President on Humanitarian Affairs, said it was commendable to have Nigeria's National Development Plan 2021 to 2025 with its strategic social inclusion pillar aligned with the Sustainable Development Goals 2030 and World Health Organization's integrated care for older people.
There are currently over 14.8 million Nigerians who are 60 years and above. According to data from the National Bureau of Statistics, with the rapidly increasing proportion and absolute numbers of older persons in Nigeria. Despite the country's youthful population, there are increasing gaps in the provision of health and social needs of older persons, both at the national and subnational level. I understand that the objective of this two-day national workshop is to assess the status of inclusion of older persons in primary healthcare services and to consider and strategize ways of realigning and strengthening institutional capacities to deliver integrated care for older persons.
The Executive Director, National Primary Healthcare Development Agency, represented by Dr. Chris Elemowa, Acting Director, Community Healthcare Services of the agency, commended the participants for the collaborative role to support the elderly.
On behalf of the Chief Executive of National Primary Healthcare Development Agency, our dynamic leader, a visionary leader in person of Dr. Feza Shuaibu, I want to sincerely welcome all of you to this very important collaborative stakeholders forum today for the care for the elderly or older persons. We all know it's actually part of National Primary Health Care's mandate, but for one or two things, it has been a neglected area, and we are pleased to have this collaboration today with the National Senior Citizen Center and WHO, who have come to reawaken us to that consciousness. And I want to assure that NPHCDA is committed to this collaboration. We know quite well that care for the elderly is a sine qua non. and it should be everybody's concern because we will all get old one day.
Also in his remarks, head of mission and WHO representative in Nigeria, who was represented by Dr. Bosede Ezekwe, Technical Officer Reproductive Health, thanked the ministry, MPHCDA and NSCC for organizing the event. The workshop was organized by the MPHDA in collaboration with NSCC and support from WHO Nigeria office.
WHO once again congratulates the government of Nigeria and the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development and your team for taking this great step to establish the National Senior Citizen Center and all it has achieved so far. I wish to reiterate WHO's commitment to support and actively participate in the partnership journey towards achieving the desired outcomes and effective service delivery for older persons in line with the UN resolution on the decade of healthy aging.